What age is best to have a Nuss procedure?
The best age for a Nuss procedure is around 13. And the reason for that is simply that most young adults go through their greatest growth spurt and pubertal growth spurt around that age. So you want to try to repair this deformity prior to when it becomes most profound, deepest, and most symptomatic. I've done patients from as young as 10 to as old as 48. So I've done both children and adults. And it can be done at any time between those ages. But the very best time is right as someone is coming into their most significant growth spurt of their life, when they are mature enough to participate in the decision to have this operation and are mature enough to make that decision and follow through with the program that is required of them after the operation is completed.
How do I know if I'm a candidate?
You know that you're a candidate if you have an indentation of your anterior chest wall. And then, if that's the case, one needs a series of tests done to determine the severity of that indentation. The first area and most important area of analysis is the determination of one's severity score, or otherwise sometimes known as the Haller index. A CT scan of the chest or an MRI will allow us to make those measurements and determine one's severity. The next area that's important is to analyze one's pulmonary function. A pulmonary medicine specialist does that. A cardiologist is also important because there can be associated cardiac issues with a pectus deformity, and therefore an EKG and an echocardiogram are necessary. And lastly, in some patients, because of their overall body appearance, they may have the trait of Marfan syndrome. And Marfan syndrome requires a geneticist to do an overall analysis of the patient to determine if they are one of the 1 in 500 pectus patients that may have Marfan syndrome, a connective tissue disorder.
Is it very painful?
The Nuss procedure does involve some discomfort, but it's important also to have a team that is available to manage that pain. We have an excellent pain management team that works with me, that will address the issues of discomfort and pain through the use of intravenous medications, oral medications, and immediately postoperatively the use of a epidural catheter and medicine given through that epidural catheter into the spinal canal. This combination of medical strategies will relieve the majority of pain for almost all patients, and by the time one is going home, you are in very little pain, managed solely by oral pain medications.
How long will I be in the hospital?
You'll be in the hospital for about 5 days, and during that time you'll be seen by me every day and by the pain service in addition, and we'll be managing you day by day from a point where you're needing more significant pain medication to be comfortable to a point where at the time you're ready for discharge, you're eating a regular diet, you're ambulating comfortably, and your pain requirement is simply oral pain medications to be entirely comfortable.
How long will my recovery be?
The recovery will be a week in the hospital, during which time the pain service and I will be jointly managing your pain requirements, which will decrease over time to the point where on the day you're discharged, you'll be eating a regular diet, you'll be ambulating comfortably, and you'll be able to go home on oral pain medication. Once home, that oral pain medication usually will continue for another 2 to 3 weeks, during which time you will increase your activities, you'll walk more, you'll feel better while doing so, such that by the time you're 4 weeks post-op, you can begin a physical therapy type rehabilitation, which will include specific exercises, working with a physical therapist under our direction, doing range of motion and resistance training, which will allow you to regain your normal range of motion and preoperative strength.
When can I get back to normal activities, especially sports that I really enjoy?
That's a great question. You know, everyone wants to know when they'll feel normal again. And for most people, that's about 3 months. However, during that last month, one is feeling better. The physical therapy is allowing a patient to feel more normal again in terms of the things they do and the strength they feel they have in doing those things. But for most patients who have a single bar implanted, by the time they reach 12 weeks or 3 months post-op, they can return to doing everything they love to do. That includes both contact and non-contact sports.
How many Nuss procedures has Dr. LoSasso done?
You know, this is a passion of mine. I love this operation. I really feel that I truly change people's lives, and I've enjoyed every one of the patients that I've been able to work with over the 13 years that I've been doing this. I've done over 600 of these operations, and I feel that this is an area of specialization for me that I've worked on early on with Dr. Nuss to perfect the operation, and now in the last few years to offer this to all ages, and to also do some patients who have had failed prior Nuss procedures or open ravage procedures, which is very, very gratifying because these patients have already had an operation that has failed them, and to assist them in achieving the great outcome that they so richly deserve and expected is very, very, very gratifying.
What are the biggest risks or complications that can occur from the Nuss procedure?
Like any operation, there are potential complications. With the Nuss procedure, there are predominantly two. The first is bar migration. I have not had, personally, a patient that had a bar migrate. Infection is the second most common problem. In over 600 patients, I've had 3 infections. Each patient was treated successfully with oral antibiotics. Each of those patients succeeded in reaching the end of their 3-year treatment with an excellent outcome in each case.
How long has Dr. LoSasso been doing this minimally invasive Nuss procedure?
In 1998, I heard Dr. Nuss's original lecture to our national association about this minimally invasive new operation to solve the problem of pectus excavatum. I was very impressed, and I sought Dr. Nuss out almost immediately, went to Norfolk, Virginia, and spent time at the Children's Hospital of the King's Daughters, and learned directly from Dr. Nuss the operation and all that is required in doing the preoperative evaluation, the intraoperative procedure, and the postoperative care for patients with pectus excavatum. I then came back to San Diego, and in 1999 did my first operation successfully, and am passionate about the operation. I've done over 600 Nuss procedures since that first operation in 1999.
When can I meet with Dr. LoSasso?
I would encourage anyone who has a pectus deformity or knows someone with this problem to seek out more information on my website. I've included in-depth interviews with patients and families, and there is a significant amount of information there that will give one the fund of knowledge necessary to understand both the problem and the surgical solution. That will then enable one to be fully informed. Once that information is understood and there's a desire to come meet me, then please schedule an appointment. Please call our number, 760-634-4090, and as soon as you've made the commitment to learn more about this, I look forward to hearing from you and answering any more questions that you might have in person. Call, make an appointment. I look forward to the opportunity to help you.